Here we have this absolutely fantastic lady. She is, 6 days out from your face neck lift. We wanted to give a little bit of a review. Now, this is relatively early, but a ton of our patients, they're like, geez, I've seen a ton of before and after pictures from your practice and other practices. So we've done this now a couple of times. How does this look 6 days out, and what, in the words of the patient, is her experience thus far? So tell us, you had the surgery. How was it? How did it go in terms of discomfort and what have you? It's not a walk in the park. Tell us what it was like.
There was mild discomfort. The main problem that I had was just I didn't want to be in bed for that many days, just because you've got to rest. I mean, it's still a major surgery and you have to rest. So that part is a drag, but catch up on some Netflix or something and you'll be fine. The main concern is that it's worth it. The result that I have is more than I could have ever imagined. I could see that already 12 hours afterward, and believe me, I searched high and low before deciding on Dr. Leong for this surgery. I had, searched the internet, found him, heard that he was fantastic, and it's true that he is. I am so thrilled at my result. It's better than I could have imagined. I can't wait to see what it's going to be like even 6 weeks from now when I have a little, less swelling. I'm barely a week out, so I know that we're not there yet, but sure. I'm thrilled with where it's going.
That's fantastic. And it's very gratifying for us. We'll show you the before and after pictures as well. The difference in the neck and the face and all throughout the face and neck is very significant.
Yes.
And this is not a conventional facelift as is quite frequently sort of offered around the country. This is what's called an extended deep plane facelift, where we sort of incise through something called the SMAS and lift both the face and the neck. Extended deep plane facelift. But it's paired to something called a deep neck lift. This is not just a little bit of liposuction and tightening some muscles. We do a lot of formal deep neck work where we remove fat under here, we shave some muscles, on some occasions we shave some glands, and then we tighten the whole structure. So what this has allowed is not just, it's significantly improved, it's a transformative difference in sort of how sort of the lower 50%, 60% of her facelifts. And what I really love is when you look at her, of course there's a bit of swelling. We're not trying to hide any of this, right? There's a little bit of bruising still. Normal. This is 6 days out, but you can also already get a sense that she looks natural. Just try to imagine a little bit of swelling gone down, a little bit of bruising gone down, and she's going to get a natural and hugely improved result. She's holding a drain in one hand. She had 2 drains. We removed one. This is at 6 days. We'll probably leave this drain in for just another couple of days. This is out of an abundance of caution and wanting to go ahead and get all this fluid out. You'll note this is what, about 6 hours of drainage or something like that? And so you can see there's hardly a thing in it. This is the kind of drain that you would have. We want to be totally transparent and with every fact about this case. But we'll leave that in for perhaps another 2 or 3 days, and then we'll get that out. And again, this is about optimizing the long-term result. And so we take every step necessary in order to do that. Okay, so that's an update at 6 days, and probably do something a little bit more like this a little bit down the road. Thanks for your attention.